Yeah, so I've been using Compex quite a lot in our rehab protocols. Just a really good way to get good muscle activation before we go into an exercise-based rehab program. You can get that type 2 muscle fiber recruitment from day one of when someone's able to load bear. A lot of times we can get altered biomechanics and altered firing patterns after injury. So just a really good way to re-educate the muscles how to actually fire when we're trying to do a specific exercise. A really good way to specifically hit a muscle that you're wanting to incorporate into a movement. So if you're seeing some type of altered biomechanics when you're doing, let's say, a squat or a lunge, you can use Compex to make sure that you are actually hitting the required muscle. So the big stabilizers, your VMO, your glute med, all these muscles that you're actually going to need during proper function. Compex is awesome for actually combating that atrophy when you get post-operation or post-injury. It's just a really good way to actually get good muscle bulk back without actually having to load the joint. So if you are joint compromised, Compex is a great tool to actually get on nice and early to be able to stimulate those type 2 muscle fibers, to be able to keep bulk within the muscle, because that's just going to actually accelerate your healing and then also your recovery and return to play straight away. Yeah, I like to use it pre-exercise. So either use it pre-exercise or in conjunction with exercises. These can be exercises aimed at improving biomechanics or just corrective exercises. So making sure that the correct muscles are firing during those exercises and that you're not getting dysfunction, because obviously dysfunction is a big precursor to actually getting injured when you're doing a sport or just anything functional. So for me, obviously, Compex is just another tool in the toolkit. When used with proper mobility, proper activation exercises, and proper recovery protocols as well, it can get amazing results. Once you use all those modalities in unison, then you start to actually get a body that's actually working a lot better than it was previously.